you don't have health insurance, don't worry. Everyone in the United States will have it in 2014. You see, Obamacare states all Americans must have health care insurance by January 1st, 2014, or face a penalty imposed by the IRS. Do you really know what that means? The Affordable Care Act was signed into law to reform the healthcare industry by Barack Obama on March 23, 2010, and upheld by the Supreme Court on June 28, 2012. This law will impact every citizen in the United States in some capacity, yet many don't really know what this is or how it will impact them. The Affordable Care Act will impact the current uninsured young adults up to ages 26, the poor, people with pre-existing conditions, smokers, and employers. First of all, what is the Affordable Health Care Act, or ACA? ACA is a law passed in 2009 and upheld in the Supreme Court in 2012. ACA expands the affordability, quality, and availability of private and public health insurance through consumer protections, regulations, subsidies, taxes, insurance exchanges, and other reforms. It does not replace private insurance, Medicaid, or Medicare, nor does it regulate your health care. It regulates health insurance and some of the worst practices of the for-profit healthcare industry. ACA's benefits to the citizens of the United States, according to the website Obamacare Facts, ensures that all Americans have access to quality, affordable health care, creates a new, regulated marketplace where consumers can purchase affordable health care, extends much-needed relief to small businesses through tax credits. It improves Medicare by helping seniors and people with disabilities afford their prescription drugs, prohibits denials of coverage based on pre-existing conditions. It limits out-of-pocket costs so that Americans have security and a peace of mind. It helps young adults by requiring insurers to allow all dependents to remain on their parents' plan until age 26. It expands Medicaid to millions of low-income Americans, and it provides sliding scale subsidies to make insurance premiums affordable. Holds insurance companies accountable for how our health care dollars are spent. It clamps down on our insurance companies' abuses and invests in preventive care. So now that we know about the ACA, let's talk about national statistics regarding who ACA will benefit on a national scale and what happens if you're compliant. What are the national statistics on why ACA was created and who will benefit from ACA? Current statistics for healthcare coverage on national level are interesting. In 2010, only 53.8% of private sector firms offered health insurance. ACA mandates that number to be 100%. In 2010, 16% of uninsured were full-time workers. ACA mandates 100% of full-time workers be offered insurance by their employer or face stiff penalties. About 15% of Americans are uninsured, which is a little less than 50 million men, women, and children. ACA mandates all Americans have some form of health care insurance by January 1st, 2014, or face stiff penalties. Poor working families are most likely to be uninsured. Smokers will pay double the rate starting in 2015. Non-smokers' rate may be $300 a month, and smokers will pay $600.
The library will close in
Current
15
ACA law
minutes.
for 2013
To repeat,
states
the
that
library
children
will
can't
close
be denied
in
health care
15
insurance
minutes. You
because
now
of
have only
pre-existing
10 minutes
conditions.
to check out books
Young
and
adults
to
up
log
to
off
age
all
26
computers in
can
all
remain on their
departments.
family's health insurance
Please
plan.
return all
Health insurance
laptops and
plans must
study
cover
room
more
cards
preventive
at this
services.
time.
Insurance companies can no longer drop your coverage if you become sick, nor can they place lifetime dollar limits on health coverage. People with Medicare receive a 52.5% discount on brand name prescription drugs and a 21% discount on generic prescription drugs while in the donut hole. Failure to obtain healthcare insurance will have penalties. According to the IRS website, Americans must have insurance coverage in April of 2014 or face penalty. The flat calculation is $95 multiplied by the taxpayer's family size. In 2015, the penalty is $325 per person with a $975 per maximum. In 2016, the penalty is $696 per person with a $2,085 family maximum. What about Louisiana? How does Obamacare impact Louisiana, or will it? ACA will have a minimal impact to Louisiana residents, according to the governor of Louisiana's website. Why? Louisiana has opted out of participating in a state-run marketplace. Governor Bobby Jindal has refused to participate due to the long-term effects it could have on the state by increasing the Medicaid program. The expansion of Medicaid under Obamacare could cost Louisiana taxpayers $1.7 billion over the first 10 years, and the cost will keep rising in the long term. The expansion of Medicaid under Obamacare will add more than 171,000 Louisianans who would otherwise be on private insurance and prevent another 77,000 people from going into private insurance. That means about 248,000 people are being forced out of private coverage and into the Medicaid program. So that is what Affordable
The
Health Care
library
Act,
will
or
close in
ACA,
15
or Obamacare
minutes.
is.
To repeat, the library
closing,
will close in
ACA
15
expands
minutes.
the
You now
affordability,
have only 10
quality,
minutes to check out
and
books
availability
to log
of
off
private
all
and public
computers
health
in all
insurance
departments.
through consumer
Please
protections,
return all
regulations,
laptops and
subsidies,
study room
taxes,
cards at this
insurance
time.
changes, and other reforms ensures that all Americans have access to quality, affordable health care. Helps young adults by requiring insurers to allow all dependents to remain on their parents' plan until age of 26. It prohibits denials of coverage based on pre-existing conditions. Healthcare insurance plans must cover more preventive services. Insurance companies can no longer deny insurance because of a pre-existing condition. Smokers will pay double the insurance premiums under Obamacare by 2015. Do you believe it is right for Bobby Jindal to deny Louisiana residents Medicaid coverage that would be qualified for under Obamacare? A quote from Senator Paul Ryan: Obamacare comes to more than 2,000 pages of rules, mandates, taxes, fees, and fines that have no place in a free country.